Does daily masturbation affect your prostate health? Hello, my friends. Welcome back. I'm Dr. Jonathan Prescott, and today we're going to have a real talk. No judgment, no awkward silences, just facts, compassion, and maybe a chuckle or two. Here's the question I hear more than you might think. Doc, I've been, taking care of business daily. Is that bad for my prostate? It's the kind of thing men rarely ask out loud, but they sure do wonder about it when the lights are off and the questions keep them up at night. So, let's tackle this head on. Does masturbating every day affect your prostate health? The answer isn't just yes or no, it's a bit more nuanced, like most things in medicine and life after 60. In this video, I'll walk you through what the science says, bust a few myths that should have retired decades ago, and share practical, no BS advice to help you protect your prostate and enjoy a healthy, vibrant life, because you deserve that. And hey, if this kind of honest, helpful guidance matters to you, don't forget to hit that subscribe button, give this video a like, and leave a comment. I read them all, and your questions help guide what we talk about next. All right, let's get into it. Prostate plus Harvard study. First, let's make sure we understand the star of today's show, the prostate. Now, the prostate is not exactly glamorous. It's about the size of a walnut and sits quietly just below your bladder, wrapping around your urethra like a snug little life preserver. His main job? Producing the seminal fluid that helps transport and nourish sperm. Small gland, big mission. But here's the thing. As we age, the prostate can go from quiet background player to scene-stealing troublemaker. It can swell. We call that BPH. It can get inflamed, prostatitis. And in worst cases, it can turn cancerous. That's why keeping it healthy isn't just about sex. It's about overall vitality. So here's the big question. Does ejaculating regularly, say even daily, actually protect your prostate? Well, buckle up, because we've got some Harvard-level science on this. A landmark study published in European Urology, the big leagues, tracked over 31,000 men for 18 years. That's not a quick Google search. That's serious science. And what they found might surprise you. Men who ejaculated at least 21 times per month had a 31% lower risk of developing prostate cancer compared to those who only did it 4 to 7 times a month. Think about that. Just by regularly flushing the pipes, so to speak, these men significantly lowered their risk of one of the most common cancers in men. Why does this work? One theory is that ejaculation helps clear out inflammatory substances, debris, toxins, cellular byproducts that could otherwise build up in the prostate and trigger chronic inflammation, which is a known risk factor for cancer. In other words, it's like taking your prostate to the car wash frequently. But it's not just about cleaning. Orgasms release a powerful cocktail of hormones, endorphins, oxytocin, that relax the body and reduce stress. And since stress is a sneaky saboteur of both hormonal balance and immune function, keeping it in check might be another reason frequent ejaculation helps prostate health. Oh, and get this. Another study in the Journal of Sexual Medicine found that men who regularly ejaculated in their 20s and 30s were less likely to face prostate cancer later in life. Early investment, long-term dividends. Bottom line, the research is pointing toward a consistent message. Regular, not excessive ejaculation might be one of nature's simplest tools to support prostate health. But of course, this is just one piece of the puzzle. And that brings us to some common myths you probably heard.
Clearing misunderstandings. All right, now that we've walked through the science, let's pause and clear out some cobwebs. Because let's be honest, most of what we've heard about masturbation didn't come from doctors. It came from locker rooms, old wives' tales, or that one uncle who warned you you'd go blind. Myth number 1. Masturbation causes infertility. Not true. Your body produces sperm like clockwork. Ejaculation doesn't deplete your reserves. It just clears out what's already there. Unless you're dealing with underlying medical conditions like varicocele, infections, or hormonal imbalance, masturbation is not the reason couples struggle to conceive. Myth number 2. It weakens your body and drains your energy. You know this one. Don't do it or you'll be too tired to function. That's a myth soaked in old school shame. The truth is, most men feel more relaxed, sometimes even more energized afterward. Orgasms release stress-relieving hormones that help improve sleep, mood, and even pain tolerance. So if anything, it might be helping you get through the day, not dragging you down. Myth number 3. It prevents all prostate problems. Let's not go overboard. Yes, regular ejaculation might reduce the risk of prostate cancer, but it's not some magic bullet. Conditions like BPH, benign enlargement of the prostate, or prostatitis, inflammation, often infection-related, have different root causes and need medical attention, not just frequency. What I want you to take away here is this. Masturbation is normal, it's natural, and when practiced in moderation, it's even healthy. But it's not the cure for everything, and it's definitely not the villain it's been painted as. If anything, knowing the facts gives you more control, not less, over your health. And in case no one told you this before, taking care of your body in private is just as important as taking care of it in public. There's no shame in understanding how your body works. That's how you stay in charge of your own well-being.
When is it too much? Now, here's the other side of the coin. If regular ejaculation can help reduce prostate cancer risk and support emotional well-being, you might be wondering, so should I be doing this every day, like taking a vitamin? Well, maybe, but maybe not. Here's the truth. How often you masturbate should serve your life, not take over it. For many men, especially those over 60, masturbating daily is perfectly fine. It can be a healthy form of release, relaxation, and even sleep support. But it's not one size fits all. Your body has its own rhythms, and so does your mind. Here are a few red flags I've seen in my practice that suggest it might be time to step back and reassess. 1. It's becoming compulsive. If you find yourself doing it out of habit, boredom, or to escape feelings rather than for real desire, it might be a coping mechanism, not a healthy habit, especially if it's interfering with work, social life, or your relationship. 2. You feel emotionally disconnected. Some men start to prefer the solitude because it's easier, but over time, that can erode emotional intimacy with a partner. Masturbation shouldn't replace real human connection if it's available to you and wanted. 3. Physical sensitivity or performance issues. Overdoing it can cause temporary soreness or even difficulty with erections during partnered sex. If your body's saying, "Hey, give me a break," it's smart to listen. 4. Porn dependence. This one's tough but important. If you're always using pornography to get aroused, your brain can start associating arousal with unrealistic stimuli. Over time, this may affect how you experience intimacy with a real partner. It's not about judgment, it's about rewiring your expectations. So how much is too much? There's no magic number. It's not about counting sessions. It's about noticing patterns.
If it's enhancing your life, not interfering with it, you're probably in a healthy range. But if it ever starts to feel like a compulsion or creates emotional or physical side effects, don't ignore it. Talk to a doctor. Heck, talk to me. That's why we're here. Remember, masturbation isn't the problem. Imbalance is. And that goes for everything, whether it's sugar, screen time, or solo time.
5 habits to help protect the prostate. Practical tips. Let's shift gears from the science to the action. Because if there's one thing I've learned in over 30 years of caring for men, it's this. Small, consistent choices shape your long-term health far more than any miracle cure. So if you're serious about protecting your prostate and aging like a champ, here are 5 things I recommend to every man who walks into my office. Number 1, eat a prostate-friendly diet. Food is medicine if you know how to use it. Load your plate with tomatoes, especially cooked ones. They're rich in lycopene, a powerful antioxidant tied to lower prostate cancer risk. Fatty fish like salmon or sardines, full of omega-3s to fight inflammation. Nuts, cruciferous veggies like broccoli, cauliflower, and green tea all get my stamp of approval. And on the flip side, cut back on processed meats, fried foods, and too much red meat. These can fuel inflammation and hormonal imbalances over time. Simple rule is, if your grandmother wouldn't recognize it as food, your prostate probably won't either. Number 2, stay physically active. Exercise isn't just for the heart, it's for the whole hormonal symphony. Aim for at least 30 minutes of movement most days. Walking, biking, swimming, even dancing. Don't laugh. I've seen 70-year-olds moonwalk better than teenagers. And don't forget Kegel exercises. Yep, they're not just for women. Strengthening your pelvic floor supports urinary control and circulation in the area most men ignore until it's too late. Number 3, get checked early and regularly. If you're over 50 or 45 with a family history or African American background, it's time to get screened. That means PSA test, prostate-specific antigen, digital rectal exam. I know no one gets excited about a rectal exam, but trust me, early detection saves lives. I've hugged men who thanked me for finding something early. That moment is worth any awkward 5 minutes in the exam room. Number 4, manage stress like your life depends on it, because it does. Chronic stress triggers inflammation, messes with testosterone levels, and makes your immune system sluggish. So whether it's deep breathing, yoga, fishing, or just laughing with friends, find your thing and do it often. Bonus tip, get enough sleep. Your body repairs itself at night. If you're always exhausted, your hormones, including those tied to prostate health, will be out of sync. Number 5, talk with your partner. This one's underrated. Communication about sexual health helps reduce shame, boosts emotional connection, and sets the foundation for mutual understanding, especially if your body's going through changes. Masturbation, intimacy, medical concerns. It's all easier to navigate when you're not carrying it alone. Wrap up this section. Prostate health isn't just about what happens in the bedroom or at the doctor's office. It's about how you live every single day. Eat real food, move your body, stay connected, get checked, and listen to what your body is telling you, not just once a year, but all the time.
So, where does that leave us? Masturbation isn't some dirty little secret, and it's not a miracle cure either. It's simply one part of a much bigger picture. a picture of how you care for your body, your mind, and your relationships as you age. Here's the bottom line from this old doc. If you're listening to your body, staying informed, and choosing balance, you're already ahead of the game. Your prostate is small, but the choices you make around it, they're mighty. Whether you choose to ejaculate daily, a few times a week, or not at all, that's your decision. What matters is that it's intentional, healthy, and doesn't come at the cost of other parts of your life. Now, I'd love to hear from you. Have you ever heard a myth about masturbation that turned out to be completely wrong? Or maybe there's a health habit you've been curious about but haven't dared to ask. Drop it in the comments. I read every single one, and your story might help someone else. And if this video helped clarify something you've quietly wondered for years, hit that like button. Subscribe for more honest, science-backed guidance. And don't forget to ring the bell so you'll never miss a new video. Next week, I'll be diving into 5 powerhouse foods that naturally support prostate health. Trust me, you'll want to add these to your shopping list. Until then, take care of yourself, inside and out. I'm Dr. Jonathan Prescott, and I'll see you soon. Stay curious, stay kind, and as always, stay well.